All right, ladies, we're in. Today we're talking about the topic of how mental health occurred during the pandemic of COVID-19. One of our questions we had today was why relief measures could have been taken. What relief measures could have been taken during the COVID-19?
I think if we was prepared and it didn't hit us all at once, I think we would have been prepared, but we wasn't prepared. So it affected a lot of people in a lot of different ways because we had people that couldn't take it. They kept as I was reading, I did see some of them, commit suicide because they couldn't take the pandemic. We had a lot of people lose loved ones, like you stated earlier, in the healthcare facility. We did have a lot of people that did not make it home. We had some people that did make it home. So I think once they realized that we had like medicine and shots, that if we had all of that already, we would have been prepared and ready for it. But it all just came at one time.
So, what would be the relief measures we could have taken to prevent it, all of that?
I'm trying to find it because to prevent it, I think we could have been communicating, yeah, being more prepared, had stuff in stocked and ready. If we knew like all the precautions, we would have, had everything lined up where we could have been like better care. Because a lot of people didn't know what COVID-19 was. We didn't know if it was,
Definitely.
airborne, or if you touch someone, they can get it. If you do this, they can get it. Like we
It
didn't know,
was
but
definitely.
if we knew, then I think we would have been great.
Well,
Anybody else?
the y'all touched on clear communication already, but it should have been more consistent and transparent messaging about the virus, preventative measures, and the importance of compliance could have been encouraged. Public cooperation,
Right.
and,
So definitely communication.
and combating misinformation. Like the proactive efforts to address misinformation through trusted channels would have been promoted accurately if we would have understood what COVID-19 was.
Yep.
Right. So do y'all think that it was already known about before it even came out?
Yes, yes,
So it would have been
Yes,
Well, yeah.
warned.
definitely.
it was. It because I read that November between November and December of 2019 is when they discovered it, but it wasn't put out there in the public until what 2020.
Hmm.
Yes.
Yeah.
Yes.
Well, I do
Yeah.
know that when it hit America, it was March of 2020. But when they actually
It was
discovered
already
it
out though.
from China, it was November, December 2019.
Yeah.
That's why it was COVID-19.
Yeah.
Right. Right. So that leads us to our next question. How mental health affect healthcare workers during the pandemic and frontline workers during the pandemic?
I
I
just
would say that after, I guess, shock that they said with the PTSD and all that, after effects, depression, anxiety from seeing so much loss and grief.
Agree. Agree.
Because I mean, if you think about it, um, a lot of the healthcare workers and frontliners of the health community or the healthcare workers, they are the one that saw all the grief, all the loss. They're the one that had to deal with it all because we
Agree.
were pretty much the front line. We had to deal with it, and then we had to take it home.
Hmm.
Yes, I agree with that. I believe the community was the front lines. Because we was like the people who was getting it and didn't wasn't aware of it. And as we come into the healthcare field, the workers and stuff, they had to actually handle it for us because we did not know. That's comes with the lack of communication. Like she said, Miss Ursula said we didn't know what it was. So about us not knowing, you know,
and
right.
also they're correct, and they're also the front front healthcare workers were also strained due to it not being enough workers. And I guess enough information out there. So everybody was in a frenzy, a
Yeah,
panic.
agree. Agree.
And a lot of
So
those people didn't want to take that home to their families.
Right.
that's why
But
that's why it was a lot of strain on the healthcare workers because they were just walking out. They was definitely walking out.
If I remember correctly, it actually compared to what it is now, like what the way the world is now, when COVID hit, we all got, social distancing and stuff like that, but it actually brought at least all I know of is from the United States. We all came together.
Mhm.
We didn't care what race, what gender, nothing like that. We all came together. And
Also, I believe that
united.
globally too, because it was the first pandemic that went globally. Like everybody
Actually,
had it.
smallpox was actually.
Oh yeah, yeah, you're right. Smallpox was, but a lot
But
of
they
it,
eradicated that one. But this is
yeah,
a totally different topic.
yeah. It was, but yeah, it did come globally, like all over the world. We try to help each other, like
But
whether the
but
United
we
States sent
but
over.
we came united. Like we came together compared to what it is now. It broke off. Now that the election and all that now. But
But I do got a little bit biased to that because of the fact that like for instance, when it came to and that I guess comes up to the next question because like during the urban areas, like they had lack of resources, when it comes to that, far as the PPE, and they started doing the telehealth thing, and then it's like they didn't have them resources in order to be seen by a healthcare worker, or they didn't have the resources like they was buying up all the water and all the toilet paper and stuff like that. So it's like it did
and
affect
that
a lot of the
and
urban areas too more.
and
the
that
food
right there, is and goes towards the other question that we had about the delivery of mental health and substance use, the services,
Yes.
because from what I found out, is the limited provider options, lack of information, including costs, low insurance of substance rates, particularly among young adults, Black individuals, men, uninsured. It doesn't matter who it was. We had workforce it's everything.
You had no
And that's
resources.
no. And that's why they created the crisis line, and they had to literally like, hey, you're in a crisis, you can go and do that.
Did anybody else have any input on that one
Mm.
when it comes to the urban areas and how it affect the urban areas more or the poor areas?
I don't think, well, the urban areas was like the last people to be able to get the vaccine. They let all of the wealthy people get the vaccine first. And I feel like what was left over went to the urban areas
Exactly.
until they were restocked.
Yeah.
The important people got the vaccine first.
Mm-hmm.
Well, and it's not just that. My mom, she went to a hospital here in Corpus, and they wouldn't test her for COVID.
Yeah, the test is too. That's absolutely correct. We
The,
didn't get
the,
tested either.
they wouldn't test her because she wasn't being admitted. But then she goes to another hospital in the same town, and they tested for it, and of course she was negative. But still, why give certain people ability, like here, we can only test these people. Why? When you could have tested anybody that came in.
So I could relate to that when it comes to like I had a family member that actually passed from the COVID, incarcerated. So they was incarcerated at the time. And like I said, a lack of communication. They did not basically help the people that were incarcerated. And I'm from up north, so I don't know how it is down here in Texas. It was in New Jersey. Um, they didn't get the shot. They didn't get the options or nothing. When she became sick, they literally just locked her up inside a shower room. And all the symptoms that she had, that she couldn't breathe and things like that, she was telling them about that, and they did absolutely nothing. Now I don't know whether because they was lack of information or the lack of resources or whatever the case may be, but they did absolutely nothing until they walked in and found her dead on the floor.
I think it was
So
probably a little bit of both.
Yeah.
yeah, it's a little bit of everything that went into that area. And then next thing you know, like I have a brother that's here that's incarcerated in Texas, and like they forced them to get
Yeah,
shots here. They said,
I
well, you
was gonna
can't have
say
family
that.
members come visit you unless you got the shot. So he got forced to get the shot in order for family members to even come visit him. So it's like, you know, it's
I
like
thought, but I thought they
pros
were
and
on like
cons.
lockdown or something. So
Mm-hmm.
some of, well, I'm gonna say some of the prisons were on lockdown. They wouldn't let family come visit. I'm
Right.
not sure about video call. I can't really remember, but I know that they were forced to get the shot.
Hmm.
Right. Right. So our next question is how did COVID-19 affect the business?
With
With a lot of closures, a lot of people lost a lot of money.
Yeah,
A
A
lot
lot
of
had to
not
actually close down.
not just
a
that, a
lot.
lot of people had to close their businesses to the point where they can't run it anymore, and
Right.
like
Hmm.
like going out of business.
Yeah.
Right. And they also came a lot of the business had to either stay open too, because you know a lot of people started doing a lot of rioting, a lot of stealing. So it's like they was trying to protect their business at one point too. So it is like they was risking their lives to be out there in the community. And yeah, so I seen a lot of that too in certain areas.
I'm
Yeah.
just gonna list. It was like mass unemployment, business, a lot of business failures, as
Hmm.
Danica stated. The chain supply was disrupted. Consumer spending declined. It was
Yeah.
increased debt levels,
Yep.
housing instability, healthcare costs, and inequality widening of the economic impact.
Definitely the
Disappropriately,
housing.
disproportionately affected low income workers and marginalized communities, exacerbating existing inequalities.
Right.
I don't know
Definitely
what
the
happened.
housing. A lot of people lost their you know, even though they don't put up like a worldwide stop and no rent and things like
Right.
that. But once it got released, a lot of people lost their homes and became
Hmm.
evicted. And it's like they couldn't work the whole time. Then when they did open up for those to work, they put stimulations on it. Like some companies wouldn't even let you work unless they had the shot. So
Right.
They
and
still
then it's like
do.
you're a year behind on rent now, or 2 years behind on rent, and them people wanted their money, and I understood that they homeowners needed their money in order to keep their homes. So
It was quite ugly.
yeah, it did come quite ugly inside that. Anybody has any more input on how to affect business? I think she just ran the whole list down. That was awesome.
Mhm.
I'm my phone disconnected, but you said the businesses. I don't know if y'all
Yes.
said you said how did it affect the businesses?
Yeah, how did it affect the business?
Like for most businesses, I know they was getting most of their stuff from like other states. I don't know if y'all said that.
Mm-mm.
So it was like hard for them to get like their produce or their stuff, sent over because the COVID. So a lot of
Right.
people lost, not only their money, but they lost like their products. produce,
Yeah, definitely
stuff like
we
that,
put
food. So a lot of people went without food. So
definitely that
Mhm.
had to depend on churches and things like that. All right, my next question was, why was it necessary to improve the delivery of mental health service during COVID-19? During COVID-19.
Due to the lack of sources in urban areas, and there's, insurance and
But what
um
made it necessary? What
Because
was
of a
necessary?
lot of depression. A
Yeah,
lot of people are going through a lot of depression, anxiety, and all that stuff.
right.
well, because it says exacerbated these challenges due to distribution, workforce shortages, increased demand. In response, policies like telehealth expansions, improved opiate treatment access, and school-based mental health services emerged. Then they came and did the 988 crisis number that was launched in
Yeah.
2022.
So that's what we're going to touch on next. That was mostly our last question there. Can you give us more about, elaborate on the crisis number and how did that come about?
Um, it, there was so much demand, like I said, and um, so much crisis. Like the anxiety. Everybody was doing substance abuse. A lot of it was fentanyl. Um, it pretty much the anxiety, depression, and substance abuse skyrocketed during COVID-19 to the point where you can't get a doctor because, you know, everybody else is going to the doctor due to COVID. So they came out with the crisis hotline so that if you do need help, you can call them and someone can actually talk to you and calm you down and talk you out of the suicide and stuff like that due
More
to,
like a AA buddy, right? That's like the AA programs they do,
yeah.
Alcohol Anonymous and stuff like that. So more like somebody to talk to, and because of the mental health they done suffered during them times. And that's a good thing when it comes to opiates. A lot of opiates did a lot of people become more dependent on drug abuse during that time, because of the lack of work and feeling the losing their homes and losing family and things like that. So I definitely agree on that and have to look more into that. I never knew about that number though. Is that still effective
I think
today?
everybody should have that number on their own speed dial just in case. You never know what might happen in the future. That number should be in everybody's phone. That way, just in case, you're going through a rough time and it's there.
Right. All right. Well, I think we touched bases on all our questions here. So just to like to sum it all up, that mental health is actually a big key in life, period, regardless of the COVID-19. It's just like, to lose things that you work for and to see your loved ones die, and you couldn't be ever like what I read, and also experience is that, the numbers they put out there when it came to COVID-19, really a lot of people didn't die from the COVID-19, but the people that did, like, they couldn't bury their loved ones properly neither. Like they
No.
sat for a long time before they couldn't have gatherings. It was against the law to have gatherings, so they couldn't bury them properly. And, so that took a lot of effect on a lot of people. Like people done lost their parents and stuff like that. And, I believe that's a hardship for everybody, whether you're on a mental state or not. It can be a mental thing on you. So if anybody have anything else to say to end our group out,
Mhm.
No, the subject could go on and on though.
yeah, that's what I
I mean,
said.
we can talk hours about this and never get anywhere because it's all our opinions. It's all what we.
Mhm.
Yeah, I always say that talking about COVID is like talking about religion. It's like
Yeah.
you just go on and on about it. But I think we touched the key points about it, especially when it comes to our topic of mental health. And that was a great job. So, yeah, that's our topic today on mental health awareness during COVID-19 pandemic.